Yeah.
All right, guys, we might get started.
Yep.
Welcome everyone tonight. I'm Serena from the Business Chamber. I'd like to thank you all for joining us for what is a really important topic. Before I get started, I'd like to acknowledge the Wiradjuri people who are the traditional custodians of the land we're streaming from today. I would also like to pay my respects to elders past, present and emerging of the Wiradjuri Nation and extend that respect to other Aboriginal people who are present here today. Other acknowledgements I'd like to make is the sponsors for the Wagga Business Chamber, and our partner is Wagga Wagga City Council, our media partner Southern Cross Austereo, and our Crow Award sponsors. I hope you all joined in on Friday, which was CSU Agritech Incubators, Roundabout Restaurant and Charles Sturt Apartments, CPA Australia, Gallagher, Laser Clinics Australia, Mercure Wagga, Navigate Advisors, Viatech, WDF Professionals, New South Wales Government, Ashfield, Wakehurst Developments and Yellow, as well as McDonald's. I'd also like to thank our platinum sponsors, Jaegers Event Hire and the Local Business Network, and our gold sponsors, Bendigo Bank, Business Enterprise Centre, Qantas, Baptist Watermark and Wagga RSL and Optus. We thank them because they make all of these events possible. So tonight I'd like to introduce to you your two hosts. I'd like to congratulate Jen Galloway as the newly elected President of Women in Business Wagga Wagga. So welcome, Jen.
Thanks, Serena.
And I'd also like to introduce to you Rhyley Hunter, who is also the newly elected President of the Wagga Wagga Business Chamber. Tonight they'll be hosting this event, and as mentioned before, feel free to put questions in the Q&A section of this webinar. Over to you guys.
Perfect.
Thank you. Thanks, Serena, and thanks everyone for joining us on what Serena touched on at the beginning, a really important topic to discuss. On behalf of the Wagga Women in Business, it's something that I guess we looked at during the COVID period of the impact of all of the restrictions around COVID, how our businesses were coping in our communities. And we came together with the Chamber and decided to host our first mental health webinar. This is the second in the series, and we're possibly going to look at the third as well. And I guess the reason this one came about was the first one really focused on the individual and the impact of mental health on the individual and what you can do, I guess, with family and friends around you who are suffering from mental health. But as a manager, I've come across a number of times staff members that have worked for me who are experiencing mental health issues, and understanding what is available and what you can do for that staff member and for the rest of your team and for yourself as a manager. I just thought it was a really important topic that we could actually look at and take our local businesses and all of our guests here today through. So we're really honoured to be involved in something as important as this, and really working with our partner with the Business Chamber. We hope that we'll be able to get some really important messages and information about the resources that are available to you across tonight. So I'll hand over to Rhyley, who will take you through our esteemed panel. And we are really lucky to have the three of them along with us tonight. So thank you.
Yeah, thank you, Jen, and congratulations as well on your new role. So, yeah, very well deserved. And yeah, I'd just like to touch on as well, it's an extremely important topic, and we've got some great panelists on here tonight that have got loads of different experience across the field of HR and mental health and whatnot as well. So I think we're going to all get a lot out of this, and obviously with what's been happening the last 6 months with COVID, I think it's even more prevalent now to really discuss these sort of topics as well and get on top of it. So thank you very much for everyone for joining. All right, so we have Fiona Piltz. Thank you very much, Fiona, for coming on. Fiona is the head of HR for the Catholic Education Diocese in Wagga. And Fiona's got over 15 years experience in HR in both the public and private sectors. So yeah, thank you again, Fiona. We also have Alicia Smith. So Alicia's recently been appointed as the Assistant State Inspector for Safe Work New South Wales. Alicia has studied both health and occupational health and safety, and she takes has a really proactive approach to safety from both a physical and a psychological health aspect. And we've also got James Smith. Thank you again, James. And sorry, Alicia, I didn't thank you either at the start. James is the Business Development Manager for the Personnel Group. He's a mental health advocate and a champion for diversity in the workplace. and he works across New South Wales, ACT and Victoria. And James also supports businesses to support their employees. So, like I said, a really esteemed panel tonight, and we thank you all for your time, and hopefully everyone gets a lot out of this tonight. So, all right, so to kick things off anyway, Alicia, I might throw it over to you to begin with, but what is a business's WHS responsibilities and obligations when it comes to mental health? Because that's probably just a bit of a, I guess, a blurry sort of subject that we all sort of need to cross anyway.
Yeah, thanks, Rhyley. Always happy to kick off a panelist webinar. So yeah, basically, I'm not sure if most people would be aware, but when we talk about health under the work health safety legislation, we actually do talk about the definition in the legislation does actually state physical and psychological health. So a person conducting a business or undertaking, so we usually refer to that as it's a legislative term, but basically it does mean all businesses have a responsibility to manage hazards associated with psychological risks in the workplace. So yeah, obviously from there, there's also, so I always explain to people, whenever you see the definition or the word health, whenever we're talking about that in the legislation, they should really be considering what other psychosocial factors may also impact that task or job that person may be undertaking. So simple things as, you know, even role clarification, or work performance, working relationships, things like that should be considered as part of any risk assessment process. And also I guess that they always interact with each other. So usually all the statistics and research shows that usually if you have a physical injury, there's usually a psychosocial aspect attached to it as to possibly why it occurred in the first place.
Okay. And what are the main psychological sort of risks that you see that businesses are either doing right or wrong at the moment?
So we do unfortunately get a lot of bullying complaints. So I guess that working relationships within the workplace is a big one. I'm actually doing some work, and a lot of inspectors are as well, with the University of South Australia, where Uni of South Australia is basically trying to develop an evidence-based tool that businesses can use to look at psychosocial risk factors and have a baseline that they can then look at, well, where do we start? How do we improve and create a mentally healthy workplace for our staff? And we're usually finding that bullying is a result of other psychosocial factors. So whether it be lack of training, lack of rewarding and recognition in the workplace, overloading one worker and another worker's not performance managed well, and things like this. So a lot of the time the bullying has stemmed from other issues in the workplace.
Right. Okay, excellent. Thank you, Alicia. Is anyone else want to touch on that at all, or all good? No, we can move forward. We've got the specialist to handle that one, so that's good. Thanks, Alicia.
Thanks. And I just wanted to touch on the fact that it's actually Mental Health Awareness Month in October, so people will see a lot of information out there. There's a website you can tap into. There's lots of different resources that you can actually get your hands on right now, and there's lots of fundraising, and I think there's a walk, a mental health awareness walk for the month of October that you can participate in. So lots of activity around that. And this month is actually Small Business Month. So it's really, I think, a really great time to actually look at these two topics and how we can bring them together and discuss how we can help the businesses in our community around this. So I guess on that point, Fiona, what are some of the signs to look out for regarding an employee who may be experiencing mental health issues?
Yeah. Thanks, Jen. So I guess I certainly, draw from my experience in HR and the things that I've observed and seen. And so I don't have an exhaustive list. I'm sure that there are many others out there who've seen lots and lots of different things. But, a key one is, people turning up late for work, all of a sudden different patterns of behaviour that they might be demonstrating in the workplace. You may normally have, a calm and considered employee who's all of a sudden having outbursts in, meetings or struggling to meet deadlines, those kinds of things. So that's, I guess, some of the things that certainly, as a manager, your staff, you generally, have built up a working relationship with them, which is why it's really important to have, good connections and interpersonal relationships. So you will know when something just doesn't feel right, it doesn't look right. But in saying that, I think it's also really important to note that sometimes we can jump to conclusions and make assumptions around, you know, what might be going on in a person's life. And we instantly, as managers, jump to wanting to find a solution or provide a, you know, provide a resolution, which is very admirable. But what we can do is actually exacerbate the issue. You know, I think it's really important, again, those interpersonal relationships and recognising when something might be out of kilter, and then really being able to have that conversation, that next step, which I think, James, I know you're going to talk about in a moment. You've got some fantastic, you know, tips and tricks in this particular space, where you can really have those honest, open conversations to really engage with the employee so that you can actually work through the issue together. So for me, it's really understanding and knowing, knowing your employee. Don't have to know their family history, but certainly it's important to have those interpersonal relationships so you can actually identify some of those things when they are out of kilter.
Nice.
Is there any training available for? Is that?
Sorry, Rhyley.
Sorry.
You go, Rhyley.
I didn't see Jen.
Camera, same thing.
You go, Jen. Go for it.
Am I unmuted now?
Yeah.
Awesome. Sorry, I just jumped in and then I was like, I'm unmuted or unmuted. New computer, by the way, so I'm getting used to it. But Fiona, you know, those interpersonal relationships that you can have in the workplace, and you know, I'm very much the person I am at home is the person I am at work. I don't have a change. You know, some people just change their personality depending on where they are. Yeah. Do you have any tips on how to develop those relationships with people so that you don't have to be best friends, but there are always the tougher relationships, I think, with some staff members, so that maybe if there is a sign, you're able to see it a little bit clearer?
I think, and I don't want to get off topic already, but certainly I'm very good at that. But when we talk about, you know, I guess people who come into the workplace and they've got, you know, I guess one front for work, and then as you suggest, some people can, you know, are very good at hiding things, because mental health in some situations, in some businesses, potentially comes with its own stigma, and you know, some people are potentially feeling, you know, quite vulnerable or ashamed, or other people might actually be experiencing domestic and family violence and those kinds of things, and people become very good at masking, you know, what people see on the outside. So for me, it's really about, you know, taking an interest and actually asking just broad questions. So you've got to build up over time, but you have to be consistent in that, and you also have to be genuine in that. You know, there's no point writing out a list of 10 questions thinking, well, I'll ask you this every single day of the week because I can't seem to crack or break down the wall. It really needs to be that genuine interest in your staff member. And, you know, it can start with a conversation around work as well. You know, so asking, yes, what they're interested in, talking about their career, you know, where they want to head. Because if you can actually start to build that interpersonal relationship from a work context, generally that trust is built, and you start to see these things, you know, these further or deeper conversations happening. So for me, it's just genuine conversation. You can't provide lip service to people. It's not, you know, it's not something that, you know, certainly, you know, from my experience, you know, you need to be genuine and you need to be real about these conversations.
Thank you.
And I guess, obviously, there's that old saying, like, leave your problems at the door or leave your issues at the door. But like, we try and do it completely different, like with our business, with Katie and myself and whatnot as well. Do you see that as well with Fiona, with larger organisations too, saying, no, bring your problems in, like bring them to us, like let's all talk about these as well if you've got things going on at home or any mental health sort of issues and things like that as well, so we can actually help and work through them, because it will, in the end, it increases productivity. Like, obviously it takes time to work through that, but are you seeing larger organisations do that, like take that approach?
I certainly think there are some out there who are absolute leaders in this regard, and they're the ones that have developed, you know, mental health workplace strategies and things like that. So there is training offered to managers, and there's support services available and wrapped around, and, you know, it's a conversation that might be part of every agenda, you know, every meeting agenda, you know, where something is talked about around mental health. It's not just about work health and safety, because, you know, it's work health and safety, but then there's the actual conversation around mental health and how people are going, and there's the, you know, are you okay kind of days and things like that, but it's all built into a broader strategy, because the more you build it into your organisation, obviously the more people are willing to open up. I do think, as I said, there are some organisations out there who are doing a fantastic job at it. There's some who are just starting and some who are just, you know, I guess, learning and finding their way. Small business, I think, is also a different kettle of fish again. But for me, again, it's really saying exactly what you did, Rhyley, which is we need to have these conversations. You need to feel comfortable coming to the workplace, because yes, it's all very well and good to say leave your problems at the door. It doesn't work that way. You know, you are human and your whole person needs to be invested in the workplace, but it also needs to be invested at home. So you can't say, I'm sorry, we need you, you know, we need just, you know, you here in this format, because it doesn't work that way. So I think the more we talk about mental health and the more understanding employers are in regards to how people, I guess, function or operate as human beings, the more genuine we can be about, you know, bringing that conversation to the fore.
Yeah, brilliant. No, that's a great answer. And James, to touch on what Fiona mentioned there before as well, how do you it's a touchy subject, like how do you approach that with someone?
Yeah, thanks, Rhyley. And Fiona's done a wonderful job there of giving a really broad description of what mental illness can look like in the workplace, and really how to address it. And well done, Fiona, because a lot of people are aware of changes in staff members' behaviour because they see it. What we're not aware of is the fact that it can be really well masked. And I've had a lot of mental illness sufferers say to me that they are the best actors in the world. They really are the best actors in the world. And they hide their behaviour by not allowing themselves to be in one circle of the workforce for too long. And so sufferers of mental illness will actually work their way around the staff. And so you actually never get to know this person really well, but to the naked eye, they look like the most social person in the workplace. And that's their way of masking. That's one of their ways of masking it. So even though we've got a full list of signs to look out for, mental illness can present as none of those signs. And that's what makes it really, really difficult to try and pinpoint. But what I would say is I love the concept of Are You OK Day. I really do, but what needs to happen before that is we need to be able to see a change in somebody's behaviour to be able to ask them if they're okay. If we're just going around asking random people, are you okay, we're not going to actually achieve anything. So we need to see evidence that their behaviour has changed, and then we need to approach them with the fact that we've seen a change in their behaviour.
Yeah. Is that a legal, just to butt in there, is that a legal standpoint that you need to see that before you approach, or is that just a policy?
What it does is it shuts out the opportunity for someone to say, yeah, I'm fine.
Yeah, right.
Yeah. Because that's the common answer. If you ask somebody, are you okay, without there being any demonstrated evidence, the answer is going to be, I'm fine.
Yeah.
But if you say to someone, and I'm a big advocate for, I've put an acronym on it, but it's Are You OK BINS. It's Are You OK because I've noticed something. And it doesn't allow the person to brush it off then. You've noticed a change in their behaviour, you've approached them with that change, and it's now up to them to explain why that change has happened. Yeah. So Are You OK BINS rather than Are You OK? And that will lead to an effective, meaningful conversation, which is what Are You OK Day is all about. So I would lead with any person. It doesn't need to be a manager. Any colleague should be confident enough to be able to approach someone and say, "Hey, I've noticed something. Are you okay?" And if that becomes standard cultural practice in your workplace, you'll be leading the nation.
That is brilliant. I've never heard that before as well. That's what the whole Are You OK Day should change to that, because it is the more you think about it, it's a closed question. Where at the moment, if you're doing that, and then it just opens up that whole discussion of, oh, geez, they've noticed this in me as well, and then you probably feel more comfortable. You go, yeah, well, this is what's happening at home, or I've been thinking about this, or yeah, that's fantastic.
Yeah, thank you.
And have you
so,
noticed that change since you've been utilising that at the personnel group? Have you noticed that change in, like, I guess, your whole employees and your whole culture around how they all approach it?
Oh, definitely. And this year, I've noticed a substantial change in the Are You OK Day marketing as well to actually put in those next steps. They did a really wonderful job of being able to promote the Are You OK brand, but there wasn't sort of the actions behind it. And I noticed this year they really went hard on those actions. So that has helped a lot of businesses to understand how to have that conversation and how to make it an effective conversation. For me personally, seeing my organisation, we're in the game of mental health, so it's always been a conversation where our organisation is all mentally health first aid trained, so we understand how to ask those questions, and we'll get on to that a little bit later on. But yeah, you've got to be able to give yourself and your staff confidence to be able to go and have those conversations. And it doesn't need to be a structured, minuted or noted conversation. It needs to be the other end of the spectrum. It needs to be a really casual conversation. Okay. And the more casual you can make that conversation, the more real the answers are going to be.
And a lot of people still obviously there's a bit of a stigma to it, which is hard. But so they keep that quiet to themselves. But say you as a manager, if you find out and someone's taking extended leave and whatnot as well, like how do you handle that with the rest of the team? Because they're not going to know what's really going on if it's not open and out the table, like a back injury, for instance. So how do you handle that?
Alicia or Fiona, just from an HR perspective, I'm passing the buck here, but because there's some risk in there, and so I just want the professionals to probably answer that before I do.
Yeah, I was just going to mention that Fiona might be best placed from a HR point of view, and I just obviously want to mention privacy, which I'm sure Fiona will touch more on.
Thank you both, James and Alicia. You've done well. So certainly, I guess, as we know, the challenge is that if somebody's away from the workplace and people can't see it, they jump to conclusions about, we've got a poor performer, why they need so much time off, I'm here late every night busting my backside and they're having a free ride, what are you going to do about it as a manager? So again, it's that instant kind of jump. And privacy is so important because unless, of course, you can get agreement from that individual to either disclose or to give something to the actual team, you are bound by that privacy, and that is something you cannot break. So in terms of managing that, so you've got someone who doesn't want anyone to know about, which is, is absolutely fair enough. It's really important for me to manage that through role modelling. So being upfront, look, Rhyley's going to be away from work for the next month. That's all I'm going to say to you. Where we're going to from here is this is how we're redistributing work. They want to see what's going to happen. So what's it mean for them? It means that we're going to redistribute work. We're going to provide these tasks. I'm bringing in, Jenny from accounts to follow up with this or whatever it might be. So they want to see what the action plan is, because when they actually can see that they're not going to, I guess, suffer's not the right word, but they're not going to be, having to pick up the slack because they think someone. So we're trying to remove for them, I guess, any reason that they can actually provide, I guess, a slant towards the other person. But whilst this is all happening and you're organising your team, you're still communicating with the person who may be off work. It's still touching base with them where appropriate. And what I have attempted, and successfully in some cases, not so successfully in others, is actually got the person to give the team something. And it might be part of, look, and it just might be a quick email. Look, I'm not that great at the moment, guys. I just appreciate if you could just give me a little bit of time. I'll be back, it's something. It doesn't have to be disclosure, but it's just something. But what I've found is when people have actually disclosed that they are suffering from depression or anxiety or whatever it might be, the amount of support that wraps around from a team is just outstanding, you know, and I think that that's really important, and that's part of what we've got to get to in terms of people feeling comfortable. But we can't get people feeling comfortable to disclose in a work environment until they're actually confident that that workplace is actually going to wrap around them as well. So that's why, you know, all of these conversations are really important. Creating that mentally healthy workplace is really important, because the more conversations, it's no longer, oh look, you know, there's going to be ups and downs, there's going to be peaks and troughs. So keeping the conversation going. So the more you can, I guess, encourage people to self-disclose and be upfront about it. And then, as I said, looking towards strategies for you and your team to be able to manage and cope with the workload. And that's what people want, as I said, they just want an action. They just want to know what's coming next. You know, people don't live very well with uncertainty. So trying to give some assurances is really important. But really it's yeah, supporting both, because that's your role. Unfortunately, you've got to balance each side of the ledger.
Exactly. Thanks, Fiona. That's awesome.
Thanks, Fiona. I think you touched on it, and to me, it's about that modelling behaviour, isn't it? So if someone's really open about the issues they're experiencing, it could allow other people to feel comfortable to talk about stuff that's going on with them as well. So if you build that culture of acceptance, compassion, and people feeling safe, I think then you're allowing people to feel like, I can share this with my team. I don't have to tell them the reasons why, but I can share that with my team. And people, and as you said, I mean, I know I've had it in workplaces where as soon as that one person I guess starts having that conversation, you'll find there are 3 or 4 more people who will sit around the lunch table and say, actually, I'm going through something similar, and then it becomes just this really open, supportive environment of everybody saying, hey, they're just having a bit of time. We get it. We all know our workloads are going to increase, but who knows, it could be me next. So let's all just be really supportive of that. So on that one, I guess, Alicia, if an employee takes some time out and, you know, they need some time out, sometimes, you know, they might need a week, sometimes it could be a couple of days. But if they do take time out, how do we reintroduce them back into the workforce in a really supportive way?
Sorry, I'll unmute. That's a really important one. I've actually got a background, I guess, in the workers' compensation scheme as well, which we've seen, unfortunately, in the last 5 years, a 53% increase in the amount of psychological claims in New South Wales, which is just crazy considering I think the increase for physicals around 3.5%. And I guess it depends on the situation. So obviously with workers' compensation, you're going to be able to access different support networks and assistance through your insurance company, and obviously CIRA has a lot of vocational programs as well to support employers, versus someone who's coming back on from a sick leave, mental health concerns. So I guess just touching on the workers' comp again, just in relation to support, I always, especially for small to medium-sized businesses, if you know as a manager or business owner that, one, you don't have a lot of time to support an injured worker, and 2, that you feel that, you know what, I've never been a return to work coordinator, I don't know much about the scheme, I really suggest to them that they jump on to their insurer straight away and ask for a rehabilitation provider, just to ensure that worker's got that extra support to start planning that return to work. So in the scheme as well, unfortunately, when someone's had more than 45 days off work, there's a 50% chance of them coming back to work. So that's what the statistics are currently showing. The longer someone's off work, the harder it is for them to come back. So, you know, there's no time to wait. Once someone is injured, you need to start looking at, well, what can I do? What assistance can I provide this person? And how can we get them back, whether it's at that workplace or, like I mentioned before, like work trials through the vocational programs and things like that. And obviously from a sick leave point of view, and I'm sure Fiona can probably touch on it too, what might be available, but understanding, you know, that even as a small business, if you can't support them through an EAP program, then making sure that you have available those Beyond Blue and Lifeline phone numbers that they can call for that early assistance, being aware that, you know, what kind of assistance can we provide locally through just attending a GP appointment and getting assistance that way. So I don't know if the other guys want to add.
Yeah, I'll jump in, Alicia. Yeah, well said. And I think a couple of things. So I think there needs to also be a bit of a realisation that return to work plans with mental health differ greatly from physical health return to work plans or physical injury, and you'll often get ebbs and flows in the return to work part. So it seems to be a much longer process, and it seems to be that just when you think things are on the way up, it takes a dive again. So there needs to be some awareness around that from management, that it's not going to be this, if I can do that, generally the graph is like that for physical return to work. Mental health can be very different. So that's probably the first thing I'd like to add about that. And there's certainly support out there for employers additional to EAPs, and EAPs are wonderful. However, EAPs rely on somebody taking that first step, and that doesn't always happen. Sometimes there needs to be a bit of a push towards an EAP. So Black Dog Institute have a depression self-test. There's a 5-minute test and then a clinical depression self-test as well. So I know organisations who put those tests on staff tables. And now that might be for their staff, it might be for the staff's family members, but those tests are available. It's a free resource from the Black Dog Institute. If you haven't been on the Black Dog Institute website, everything you could ever hope for is there, and it's a wonderful, wonderful organisation. But yeah, there's some wonderful tests there available for anybody to take, and I highly recommend you push those out to your staff at any time and let them know that they're available for themselves or family members or loved ones.
And just quickly, before we've had a question come through as well, but just quickly on that, like obviously bigger organisations like the universities and whatnot as well, they have EAP programs in place, but for small businesses that don't have those resources, is that the main one that you'd recommend, or does anyone at like the Black Dog Institute, or is there any other sort of resources that you would all recommend? James first, maybe.
So there's a wonderful program out there called Work Assist, which is a federally government funded program that gives any organisation and any person in that organisation who is diagnosed with a mental health condition 26 weeks of support. So they get assigned their own case manager who will then work through any work related issues for them. We'll hook them up with appointments. Generally those appointments can be funded as well. And any interventions put in place are fully funded as well. So all that's needed is the person needs to have a diagnosis, the employee needs to have a diagnosis. They need to be working more than 8 hours a week consecutively for 13 weeks, and they need to be between the ages of 14 and 67. And that's generally the eligibility. So if you've got somebody who's got a diagnosis, Work Assist is an amazing resource, and unfortunately not many people know that it exists.
Yeah, no, that's great, and yeah, I definitely didn't either, James. So it sounds like a really good resource. And Jenna, we will definitely put so at the end of this as well, we will send an email out the next day or two as well with all these links and resources provided as well. So
great, thanks. Fiona, did you have anything to add to that one before I go to the question from our guest attendees?
I was probably just going to mention also that, and many of you would be aware of this one, but you can attend, staff can attend their GP, so anyone can attend their GP, and they can actually have access to 10 subsidised sessions with a psychologist or a counsellor or whomever that may be. So by subsidised, that obviously depend upon the provider, but there can be a mental health plan put in place with their doctor, and that just gets signed off, and then they actually receive subsidised appointments. So that's really important to know as well.
And it's really good. I've actually used that program before, and it's excellent. I've done it, and I've done it for myself. I've done it for my partner, and you can do it for children. And and if you've got a great relationship with your GP, they'll also make sure that it's with somebody that you feel really comfortable with. So it's a great resource for people to tap into. And we spend, people go and see their GP and feel quite comfortable telling their GP or their hairdresser their life story. I think hairdressers should also be able to provide referrals for programs like that, because I think they probably take on a lot of people's issues when they're having conversations. But I think it is a really great resource to tap into. We've got a question here. If someone has a pre-existing mental health problem prior to joining your company, would they be eligible for assistance from work cover insurance? Alicia or Fiona, I don't know if either of you know the answer to that one.
Yeah, so I was just going to mention no. Unfortunately not with the workers' compensation system. It is there for those who are injured whilst in their employment. So obviously work has to be a contributing factor. In saying that, I do know a lot of rehab providers, if you are looking for that type of assistance, that you need to develop a return to work plan, a graded approach for them to come back, reduced hours, reduced days, those sorts of things, that obviously through workers' comp, it's free to employers, so it doesn't cost them any money. It's not a premium impacting cost. But if it is for someone who has a pre-existing mental health problem and may need to come back on a reduced, I guess, plan, then a rehab provider, I know a lot in town, would still offer that service at a fee though. So that might be something of interest.
And Alicia as well, how do you determine what is a factor, if it's a workplace or if it's something personal outside of work or whatnot? Or, and like, just to follow up from that as well, like, is, because obviously other, people have different resilience levels and different, coping mechanisms when it comes to, say, stress or workloads and things like that as well. But can that be a contributing factor if someone says this workload was too much for me? Is that a risk for a business to take, and how do you mitigate that?
Yeah, definitely. So because it's a no blame system as well, I think that's also why we're seeing a lot more people are putting in claims, hearing that other people are putting in claims, I believe. But it really comes back to perception. So if someone's perceived that there's bullying in the workplace, then usually that's an accepted claim. Employers, I guess, I've seen a lot recently as well where, there might be talk of someone might be underperforming in the workplace, but never actually put them onto a performance management program. So they're not following their policies and procedures. Those claims usually, because that's perceived as bullying or they're talking behind my back, but nothing's happening, they're usually becoming accepted claims. So that's why when I visit employers, I really stress to them that the best way to create that mentally healthy workplace and to ensure you're reducing your chances, I guess, of people coming forward to say, I feel this is a work-related claim, that, you're making sure you have those systems in place. So you have a procedure that they can raise a grievance. You have a bullying procedure, a sexual harassment procedure in place, and you actually do follow them. Because there is then obviously provisions in the legislation in relation to a business taking reasonable action as to, a claim being disputed. But yeah, unfortunately, because it comes back to someone's perception of how they feel that business is acting, then yeah, that kind of where we're getting a lot of approved claims.
Okay.
Thanks for that, Alicia. Anything that anyone else wanted to add around that point? We might move into actually looking after ourselves. When you talk about bullying, Alicia, in my mind, I'm thinking that's a whole nother webinar. We could spend a couple of hours talking through from an employee, an employer, a manager. To me, it just seems to be something that you get exposed to or you hear about a lot, and it seems to have got much worse over the years, the things you read about in the paper and the things that you hear about from your colleagues or friends. So I think that could be a webinar within itself on what we do from a workplace bullying perspective. Rhyley, did you want to go to the next question around leaders and supporting managers? Yeah. Yep,
for sure. So, yeah, obviously leaders, suffer mental health. They're not, they're not. I just can't think of the word. It doesn't discriminate. That's what I meant to say. I finally got there, didn't I? But yeah, how do you suggest leaders look after themselves while supporting staff? Because obviously they're hearing a lot of, different things that are happening as well. Like, how do they not let that affect them, and what do they do to support themselves? So, James, did you want to start on that one?
Thanks, Rhyley. Not really, but I will. No. So leadership's the hardest part because that's the role that you don't really get any thanks or any reward or any you know what I'm trying to say.
You've got the same disease that I have, James.
Yeah, I know, I do. It's called Thursday nightitis.
It can transfer through Zoom, I've heard, anyway. Sorry, mate.
No, that's all right, mate. It's a thankless role, and leaders often feel very much alone in that space. So it's really, really hot topic, this, and I feel like Jen, it's probably another 2 hours to talk about the role of leadership. What I'll say is that it shouldn't be approached any differently. Leaders should lean on each other, and this is where support groups and industry groups are really, really important. Chambers play a really vital part in this, that it actually brings leadership from different organisations together, and they've finally got something to talk about together and lean in on each other, and that's a really important trait. But also, I think that it's also important that leaders lean on their staff as well. You know, it needs to be a two-way relationship, and this is where I think the walls are breaking down a little bit, where it used to be a one-way relationship. I think COVID has created an environment where all of a sudden everybody's on a level playing field. All of a sudden we are fighting a virus and an economic situation that none of us have ever faced before, and all of a sudden it levels everybody out. So the things that as a leader that I might be feeling or somebody else might be feeling are now the same feelings that the team's feeling, and that hasn't happened before. You know, we've had instances where that's happened specific to industry or specific to organisation that might not be going well, but nothing blanket like this on a global scale. So I think now's the best opportunity for organisations to really bring everyone back to a level playing field and ensure that everybody's being looked after.
And are there any resources in that, like Alicia, you might well know, that Safe Work New South Wales have for leaders or managers, or Fiona, mate, you may well know as well?
We have had for a little while now, there's actually free training available to small to medium businesses that have less than 200 workers. So there's actually specific training for workers in relation to their mental health and understanding their mental health, and I guess being provided with a few skills to deal with those issues. And then there's, and it's all provided by Black Dog Institute, but obviously it's part of the mental healthy strategies that we've got till 2022, where we want to help improve businesses in this space. We've got, I can't remember exactly, but it is Black Dog Institute training for managers as well, and that involves a 1-hour workshop. And there's also an always available work health safety advice hotline or video conferencing facility where businesses can ask for general advice as well. So that's available, and I think we'll be able to share the links afterwards. I sent those through. There's also, I was just going to mention, sorry, there's a fair few things, so I had to write it all down. So if anyone's trying to assist any injured workers at the moment, there's actually the CIRA Recovery at Work toolkit, which has been developed, I guess, to assist those during COVID as well. So we know suitable duties are obviously harder to find at the moment. And there's actually extra vocational assistance available there around funding and grants available to help keep those injured workers at work. And we've also got the People at Work survey. So that's another online, I guess, risk assessment where a business might want to look at, well, not so much from an individual point of view, but how are we going in that space? And we're hoping to have that as a web-based option by the end of 2020. And we've also got the draft code of practice for managing risk to psychological health currently open to the public for comment. So I'd love for small and medium businesses especially to get on board and have a look at that code of practice, because at the moment we have no guidance for businesses in New South Wales other than referring them to the Safe Work Australia guidance material. And having a code, I think, will not only help businesses but individuals who experience bullying or psychosocial risks in the workplace with an avenue to go, well, I'll go read that guide and see how I could support my managers by raising it and giving them ideas of how we can improve the workplace. I'm a big believer, it's a huge chapter in the legislation around consultation. So businesses are meant to consult on this stuff. So involving the workers in every aspect of work health and safety, I see as those businesses really do have great systems. They have less absenteeism, they have engaged workers and all the rest of it. So yeah, there's a lot happening in this space and lots of assistance as well out there, hopefully, that if anyone wants to access it, or even, I don't know if we're able to talk to people later, but we also have a free advisory service to small businesses with less than 50 workers. So if anyone would like a one-on-one with a safe work inspector to just look at psychosocial risk factors in the workplace, then we're open to meeting with them as well.
It is interesting, like you said, about the absenteeism, because like a lot of businesses that I speak to as well, once they do, you know, encourage people to come in with any issues and not leave them at the door, like we said, that seems to just fall like quite dramatically as well, because they are more comfortable still coming to work and not, yeah, and actually discussing it with people as well, and having that open environment instead of hiding away at home and, you know, taking sick days and whatnot as well and trying to deal with it themselves. They're being more open and going, well, I can come in and do that. So it's yeah, it's really good to see that change.
Yeah. And I was just going to also mention as well, because I believe most people might be in the Murrumbidgee area, but the Murrumbidgee Primary Health Network also have some free training available on their website. So there's a lot of information, and that's I guess, a huge thing we see with whenever we see bullying or whenever we see a psychosocial risk within the workplace. We find that a lot of the time the management or the leaders within the workplace might lack a little bit of understanding in that space around what their responsibilities are. And
Fiona, say in your situation, like in a large organisation like the Diocese, do you have specific things for your leaders of all your different departments where they might get together, say once a week, once a month, to actually discuss their own mental health, or do other organisations do that?
I guess, Rhyley, that's where, you know, being new to the Diocese, that's where I'd really like to head. And I think it's, you know, we'll go back to that mentally healthy workplace. How do you start those conversations? Certainly, you know, in previous organisations I've worked in, as I mentioned, it was part of, you know, your agenda, which you might have a monthly or weekly meeting or whatever it might be. Each team had it as part of the conversation. And I think that's what's, you know, really important, is that you actually just start the conversation at the top, model that behaviour, model those, I guess, you know, those conversations, and then people just, you know, come along for the rest of the journey. And with leaders, I guess, certainly a couple of things from my perspective. Back to the, I'm going rogue, Rhyley. But back to leaders. I've certainly accessed the employee assistance program myself, and not necessarily for me, but if I need to understand what's the best strategy for dealing with or working with someone who, you know, might be suffering from particular anxiety issues or whatever it might be, you know, you've got to go to those expert people to ensure that you're well equipped with the right tools, because, you know, there is nothing worse than thinking, I'm gonna say something wrong. What am I going to do? You know, and so that's what's really important for me. Finding the right people to lean on is absolutely important and really critical. And whether it be your peers and colleagues, you know, I've got my people, you know, and we've, you know, I kind of, you know, who to pick up the phone and ring for a particular issue. And I think that's why networking and things like this are really important, so you can actually tap into resources, and you can tap into people, you can tap into experts, because that's what, you know, I guess the real I guess outcome for something like this workshop is, it's to actually find the go-to people, because we are all in this, as you say, together, and it's not discriminating. So, you know, I think more and more we have these conversations and we find our people, that, you know, the better off we all will be as leaders, and we will learn to, I guess, you know, manage each thing that comes through the door and do it in a really respectful and I guess confident manner.
That's such a good point about, like, you picking up the phone and using that EAP as well, because you do hear that from leaders as well. They need a debrief after. Like, sometimes they're extremely heavy conversations, and you're not a trained counsellor or psychologist or whatnot as well. Like, you might know your particular business or industry, but to be able to have that debrief is so important, and be like, yeah, you're on the right track, or if they said this, all right, go down this lines tomorrow or whatever. So it's such a good point, which I didn't think about, to utilise. So
And I'm just really conscious of time, guys. It's 7:55, and we could. I feel like we could talk till midnight on that. But we do have one question here in the chat box from Mark around, I guess, policies and procedures for asking staff prior to them joining a company, your company, in relation to any pre-existing mental or physical health conditions. So, you know, I don't think it's something that you get people to tick boxes during the employment interview process. So Mark just wanted to get an understanding around what kind of policies and procedures should or are allowed to be asked when it comes to questions around people joining your company. So I'll throw that one out to the panel.
I was just going to comment that certainly you can pull together, there's lots of different checklists out there of the kinds of questions that you can actually ask around a person's, I guess, background and history. So pre-employment or pre-screening questionnaires that are appropriate. You really need to probably just think about the kinds of things that you need to know and why you need to know them. And that's what's really important. So if you've got a person that's coming into, you know, a particular office environment where it's customer service that might be high stress, you might ask different questions than someone who's going to be working in a packing shed where they'll have no customer interaction. So it's really important that you actually assess your workplace and you assess the needs, the inherent requirements of the role and the needs of the you know, potential applicant, and really just asking those broad questions. Obviously, if there's something, you know, if something comes up around, and I know exactly where this question's coming from because I've had it asked many times before, which is if someone ticks on there, yes, I have, you know, a mental health condition and depression, and then someone says, oh, well, you know, look, that sounds like it's hard work and we're not going to employ them. Absolutely, that's discrimination. So it's really important that if you're aware of these things, but the person's the right fit, you need to just follow your follow a normal process where you can be sure about the fit of the person to the role and into that organisation. I'm probably talking around in riddles here because it is such a complex issue, that one. But if you think that asking a question doesn't have a real, you know, for the purpose of just wanting to know, you know, for whatever reason is not really consistent with the job or the requirements as to whether you need to know that information, be very wary that that could come as a, I guess, a claim for discrimination. So if that person was then not appointed to that particular position. So it's certainly lots of resources out there and lots of people to lean on in that space. And in particular, I would probably refer you back through your business chamber who'd be able to assist in trying to support you around some of the, I'm trying to think there's a couple of organisations in Wagga at the moment that I'm aware of that can provide that sort of assistance and that scrutiny across those checklists, but certainly just err on the side of caution with that. And Alicia, you may have something else you want to add in that particular space.
No, I think you're spot on with that one, Fiona. And it's more from that safe systems of work point of view, that if you have a really clear job description from the get-go, then you really understand from your point of view as a recruiter what you're looking for that person for the job. So like from a workers' comp, obviously I was helping a lot of injured workers try and find employment. And the advice we actually gave them was you do not need to disclose unless it will impact on your ability to do that role. And that's when you'd have to talk within the interview or over the phone with the employer to say, you know, is there any way we can change the role description and those sorts of things. So they do not need to disclose unless it's going to impact on their ability to perform the role. And even in saying that, nowadays it's usually you also need to look at what's reasonably practicable as part of, you know, there might have been an aspect of that job you could change to enable that person to do the role. So yeah, you've got to be quite careful with that one.
I know it's a hard one, but if they don't disclose, and then another, like that does occur in the future as well, in 3 to 6 months' time, say as well, like does that fall back on the employee then or the employer, or is it just dependent on the circumstance? Because it's a tricky one.
Yeah, it's definitely dependent on the circumstances. There has been cases where someone has had, unfortunately, pre-existing injury, but it may be a personal psychological injury and not related to any work, but then you go to a workplace and an aspect of the job, it might have been work overload or something, but there needs to be something within that workplace that has aggravated that condition. So that's why it's really important employers do put in place, you know, the mentally healthy aspects of the job, and yeah, starting to look into this space if they haven't already.
Yeah. So a lot of the onus, guys, just finally, and then we'll wrap it up anyway, but a lot of the onus to this sounds like it comes back on the employers to make sure they set the right environment, they have the right policies and procedures, and they actually follow them and implement them. Is that about right?
Can I also say, Rhyley, that I'd rather employ somebody with a diagnosed or disclosed condition than an undisclosed or non-disclosed condition. So I really urge employers not to look at a disclosure as a negative. It's actually a positive. You now get to work with that person and put some interventions into place, and there is bucket loads of money available from the government to put those interventions in place. You just got to know where to find it. And for anyone interested, the employee assistance fund, if you go and Google that, it's a federal government funding body that will fund interventions for anybody with a diagnosed physical or health condition in your workplace, up to about $30,000 worth per person. Yeah. They'll also fund mental health first aid training for for supervisors up to $1,500. So you can generally get about 6 or 7 supervisors through that funding on one person having a diagnosis. So there are, we really need to change that mindset to say, well, actually, employers, you're better off working with what you know and access it, because if you don't know what you're getting, you're in a much worse position.
Yeah, that's fantastic.
That's great, James. And I think touching on that mental health training as well, it's one that I always encourage people, put your hand up for it. You know, coming from big organisations, it is something that is readily available. So it's one that if you see it come up, you know, some kind of a staff email for people to participate in mental health training, or it's something you're interested in, and as you said, James, there's an opportunity for funding around that as well. I do encourage businesses to opt in for that funding, and for in supervisors, you know, you might have a team of 1 and think, oh, I don't really need it, but you don't know next week you have a team of 10, or that one person could be somebody that needs your help. So I do encourage people to put their hands up for that training when it's available.
And I know we've gone over time. It's just something I always love to ask people anyway, but does anyone, like, with obviously all the push towards mindfulness now, and I'm massive on it myself too, with meditation and yoga or breath work or whatever it is that you're doing, organisations like, say, yourself, Fiona, you're looking to do things like that where you can incorporate a 5 or 10 minute meditation on a daily basis for staff, or James or Alicia, like, are you starting to see that more?
Fiona?
I know that you're looking at me. To be honest, that hasn't been something that has come up so far in the course of I guess my new role. Previously, it was touched on, and we did have a number of different programs in place where we did, you know, offer yoga and different sessions at lunchtime and things like that. It has become more, I guess, part of the conversation and the rhetoric in terms of, have you tested this? Have you tried this new app? Because there's so many apps and things like that out there now. So I have learned a lot about what's available. I have to say I'm not a very good practicing mindfulness person.
Yeah.
I don't have time to sit still, really.
I just want to ask, is like thinking it's more of a preventative and an ongoing maintenance sort of thing for everyone, instead of letting these things build up.
Yeah, and what organisations that do it really well are those that that find that perfect balance, you know, because if we're chucking on health and well-being on top of everything else, all of a sudden the noise gets so great that it actually has an adverse effect. So organisations just need to find that perfect balance of being able to provide support and those healthy initiatives as well.
Excellent.
Yeah.
Thank you, guys.
Awesome. Get outside and go for a walk. That's one thing I say to people, like, step away from your desk. I mean, you'd be very proud of me, Rhyley. I'm a half an hour yoga person every morning before my children get out of bed, so that I'm a better mum and I'm not psycho bunny by the time they get up. So it actually does give me that time in the mornings just for me. The sun's coming up, it's really lovely, and I just feel great about my mornings. There's still stress. I have 3 kids, but it's a little bit stress less by doing that. So it is everybody finding your thing.
If you don't do it, do you notice it, Jen?
Yeah, big time. Yeah, and so does everybody else, by the way. So you could do a survey that morning and they'd all be able to tell you. But it is about everybody finding their thing. And Fiona, you know, I'm not a mindfulness meditation kind of person either. But, you know, if I stick a podcast in when I'm doing stuff and walk around and just escape from what's going on, there are little things you can do in the workplace by just telling people, get away from your desk. You know, don't eat at your desk. Don't, you know, get outside and go for a walk. Or walking meetings are something I introduced, you know, and I think that really makes a difference. You can still be so productive by just walking outside, but you're just not stuck in the same, you know, 4 walls all day long. So
yeah, exactly.
I think COVID, as you said, I think, James, you were talking about before how it's been a bit of a level playing field thanks to COVID, but it also made us all stop and go, what are we doing? What kind of lives are we living? Let's just step away from this chaos and start to think about looking after our own mental health and those around us. So in one way, it has been a big blessing, I think, for the world. Maybe not the States, but for the rest of the world.
Yeah, I agree, Jen. No, look, everyone, thank you so much for your time tonight and for coming on, especially to, Alicia, Fiona and James. I think all 3 would be on LinkedIn, I'm guessing, as well. So if anyone wants to jump on there and connect with them if you've got any other questions, or you can also ask Jen and myself as well. We can definitely filter things back. We will get some resources out to you in the next 2 to 3 days as well. So,
Definitely.
Yeah, we may well sort of obviously get onto the panelists and get some more clarification around some of those links, but they seem extremely beneficial. And I think tonight's been great. It's opened my eyes up to a lot of different programs and assistance and even funding options that I just did not have a clue about. Thank you all for coming on and giving us your time. We really appreciate it. Anything
Thanks
from
for having me.
No, thanks everyone. I think it's great. We will look at continuing this series in some way. As we said, we spoke about bullying. There's some cultural mental health issues that we can maybe look at around diversity and stuff like that. So we've lots of topics that we've been discussing as a committee for women in business. And I think partnering with the Chamber really helps us to kind of broaden our reach as well. So it's been great. So thank you, everybody. Enjoy your Thursday night and have a lovely cup of tea and relax.
Yeah. All right. Namaste, Jen, and I will see you in the morning.
Namaste. Yes. Yes. Namaste. Yeah. Thank you.
Thanks so very much, guys. See ya.
Bye.
Thanks, guys.